Well, good afternoon. I don't have a lot to say, but I'd be happy to take your questions. I would just start by saying I think the governor's announcement today strikes the perfect balance between continuing to protect public health and also reopening the state and local economy. So I'm pleased with the roadmap that the state has provided. I think it's a very strong roadmap that will allow businesses and organizations, faith communities, nonprofit organizations to be able to follow in an easy to understand way. So be happy to take questions.
So the first step of this program will involve limiting the people in bars and restaurants. How is that going to be enforced?
So I guess I'll try to repeat a little bit of what the governor said today. It's upon each of us to make sure that we abide by the guidelines. It's not like we have a whole army of people that we're deputizing to go out to make sure that every business is living up to the guidelines laid out by the state. I'll tell you what's happened over the last several weeks. There's not been a shortage of people dropping a dime, if you will, on people who they thought were breaking rules. Many of those calls turned out to be completely false. I'm sure we'll have more of that. But I think the bottom line is it's incumbent upon each of us, whether it's an individual, we control a business, or an institution, to follow the rules as laid out by the state.
The governor laid out, obviously, his 5-step plan. You mentioned that you're pleased with it. Does the city anticipate following that as a hard rule, or do you plan to divert in any way?
At this point, we plan to follow the guidelines laid out by the state. In our daily briefings with the hospitals and the local health department, from the beginning, the hospitals have been well prepared. They have great capacity in terms of PPE, in terms of ventilator and ICU inventory or capacity. So that's the one thing that all of us can drive, and that's what we can all affect. And to affect that in the most positive way, we have to abide by the guidelines. So yes, we'll use those same benchmarks. And the fact that the state has already rolled out a robust testing and tracing program really helps. It gives me greater comfort to know that's going on statewide, and the governor's very committed to making sure that program is successful. We announced yesterday our local testing program, so I think there's enough going on that we should be giving employers and employees greater comfort to get back to some sense of normalcy.
This community has not seen a large number of deaths like other communities, even surrounding us, have seen. What if there's an increase as soon as we start to roll out some of these new measures? Do you have any plan in place to roll back again?
So we'll continue to track that along with the state, and if we, as I said, the local hospitals have great capacity. From the beginning, if you'll go back to probably the first time we started talking about this, we talked about the importance of flattening the curve so we don't overburden our healthcare systems. And our healthcare systems locally are not overburdened, and there's plenty of capacity. So I think one of the beauties of this plan is it's very specific. So if there's a glitch or a spike somewhere along the way, we'll be able to quickly identify the source and respond in a very quick and appropriate way.
Is the task force that you mentioned a few weeks ago still working to prepare these businesses for reopening and distribution?
Yes, Steve, you want to come and talk about the task force? Stand by while we have a change of microphones.
If you want to stay close, I'll just stand.
No, we've got to be 6 feet apart.
Oh, that's right.
Surely you've heard about the social distancing. It's been in all the news.
Okay, guys. Well, we're just gonna hold it. Can you hear with that? Is that good enough on the mic? Okay. To answer the question, the task force has been working nonstop for the past couple of weeks. developing plans. They will continue to work within the framework that the governor laid out in the Back on Track plan. This next week will be a lot of workshops, a lot of direct contact with businesses, making sure that they understand the guidelines that have been put in place, and making sure that the resources are available for those businesses as well. So a lot of planning, a lot of work to happen, but we think it's a thoughtful, phased approach, and we'll continue to work through that. Any other questions?
Can you give us an update on the task force?
Sure. There's 5 main areas. Business assistance, they had a lot of town hall meetings last week, which were very successful. A lot of people participating. From that, we identified a lot of the challenges and the resources that they need. We had quality of life, which is all about tourism, our parks. A lot of our venues already are working on plans to reopen, so when the time comes, according to the Back on Track plan, we'll be able to open up the doors. Food security is a big issue, and we've been able to connect a lot of the food agencies and resources in the community. You've seen some of the announcements. We put the food map on reopenevansville.com, but we continue to work with them, and we're getting them new sources of financial assistance so that they can expand their services. Government operations, obviously, we're making sure that our employees have the appropriate PPE, and making sure that services are not impacted. So there's a whole lot of areas and a lot of volunteers that have stepped forward. The mayor mentioned the workplace safety and testing, the study that's taking place. So there's a lot of things happening. Best practices are being developed. There's so many different areas that local government is able to step in and cover the gaps.
Is the city providing local businesses, any type of assistance in locating, supplying PPE to their employees? I know that some of them have had a hard time finding it.
Right. Right now, we are just directing them to the proper vendors. A lot of the vendors, the local vendors, are being very generous in terms of providing low-cost PPE. So the Chamber of Commerce has been instrumental in helping us compile that information. It's on the website. We're also using an inventory list from the state. So however we can help, and we'll continue to do that.
Will this continue to add a burden onto these small businesses? Is there any kind of relief for them to pay for this extra cost?
Sure. Well, as you probably heard last week, the city had its first revolving loan fund for small business assistance. I think in the coming weeks you'll see more programs come out and be promoted, not just from the state of Indiana and the federal government, but also local government as well. So anything we can try to do within our authority and our resources, we'll try to do that.
What's next?
Well, it's digesting the plan and working with our elected officials and making sure they have the information necessary to make decisions and provide the guidance and the resources to the businesses and the entire community.
The first round of funding went out recently to nonprofits here in the area. From what I understand, there's been a process of trying to select the next round. Any update on where that stands?
Apologies if you lose.
So I can't remember off the top of my head how many initial applications we had, but clearly one of the first big major areas of need that has been recognized has been food. So the first $200,000 in grants went to organizations that were working in that space. There is an entire committee that vets these applications, and there will be another round of funding going out before long. The food need is very strong, and we'll continue to focus on that, but prioritizing the needs as they come in by agency.
Just to follow up on that question, you mentioned food was kind of the main topic for this first rounding. Moving forward, is there still a need for those food resources to get funding, or do you plan to kind of shift focus on other needs of the community?
At some point, additional needs will be met, but right now, food is a primary need.
Mayor, how is it that food security ended up being added instead of being one of the initial areas?
Actually, it was in our early discussions. It was on there, and then it just, during the course of moving quickly, we didn't, and then like overnight, we realized it needed to be on there. So it was not really It'd been part of internal discussions, but clearly with as much good work that's been done in this space in the last many weeks, it's clear that there needs to be a sustained effort in this space for a good while and beyond. You know, the governor put forth a great goal of having the state completely open by July 4th. It's my belief that we're going to be working in food security area well beyond July 4th, and we need to be prepared to do so.
Can you tie together the testing and the reopening, the testing that starts Monday and the reopening? How does that come together?
I'm not sure I understand.
Why is it necessary to do the testing as it relates to the reopening?
Why is it necessary to do this? Well, I thought we discussed that pretty thoroughly yesterday, but it's really to understand.
Yeah, but you were wearing a mask in the audio today.
Oh, well, I apologize. We were in a hospital. So it's important to make sure we understand the prevalence of the virus in the community. It's also important to do additional testing so we provide employers and employees with a greater sense of comfort in returning to the workplace. And it will provide additional data for policymakers who are trying to decide whether the current guidelines that have been laid out by the state we should remain on that schedule.
Why is it necessary for us to do testing though?
Why is it what?
Why is it necessary for us to do our own testing if the state is not?
I think because we have the capacity to do so. And we have a great facility in the Stone Family Center for Health Sciences. One of the premises of expanding the medical school here was to expand the clinical research component here in Evansville. And so I would say, why not? We have a wonderful resource, strong healthcare system that does a lot of work in the clinical research space. So I think it's a great partnership, and the more data that we can provide, the better.
Thank you.
It is hard to hear them. Yeah, John. No idea when the Civic Center is going to reopen. County Commissioner Jeff Hatfield and I have talked about that this afternoon. We're going to get together again early next week and look at that. It won't be next week. We'll continue to have city employees work remotely, and we'll make a decision, you know, I would say in the next week or so about the future of the building and when it's open to the public. Going once?
Can you give us an update on our city's economy? How is it doing? Okay?
I would say we're not recovering well yet because we're not open yet. So obviously businesses have taken a big hit, and we have to make sure that we get on an even keel, and to do that we have to abide by the guidelines. And so I think it's way too early to determine what the economic hit to our city is, but I mean, it's substantial. There's no way, you can't paint it in any other manner, I believe. So I'm sure businesses and industry sectors will be determining in the coming weeks what their individual losses are and what the impacts will be, and businesses will be responding accordingly.
Do you know of any that have had to close because of this? I've not heard of any.
It seems like I've heard in some local media, but I couldn't tell you off the top of my head. I'm sure there have been some. Okie dokie. Thank you.
Thank you.